Good morning, guys. My name is Keith Grant, Senior System Director for Hartford Healthcare's Infection Prevention Program. So, if you like, I've said thank you, Tina, so many times in the beginning of this, but I want to formally say thank you, Tina, and this entire team. Over the last few months, we've dedicated a lot of time, energy, and effort, especially from these guys, to ensure that the right information goes out. And as much as I come up here and I seem very prepared, most times all the information that I present is presented to me by Tina and her team, and I really genuinely appreciate that. In fact, getting me over here on set is Tina's responsibility, and she's ensured that that's happened for the most part.
I couldn't do this without you.
I genuinely appreciate you guys. All right, and again, advocating for and being grateful for the efforts of all our Connecticut citizens. In fact, in the studio, we're just talking about, if you look at the graph in Connecticut, how much effort that you could see that has been put forward in social distancing, and you can tell in proper infection prevention practices. And if you look around with the phase one approach with the state and how people have responded to that and ensuring that proper social distancing and the proper usage of PPE is done in those settings. So as I begin, as I've always started, I just want to appreciate the efforts of specific people, specific group, but this time is for all Connecticut and definitely for Tina for helping with this consistently and her team. With numbers for COVID-19 disease in Hartford Healthcare, I'll just go over that as always. So total for our acute care side, we're at 37 positive with 240 PUIs at this time. And how that break down, Bacchus Hospital with 2 positive COVID patients and 28 PUIs. Charlotte Hungerford's with 3 positive and 67 PUIs at this time. Hartford Hospital with but 18 and 89 PUIs. Midstate Medical Center with 2 positives and 10 PUI. St. Vincent Medical Center with 8 positives and 6 PUIs. HOCC, Hospital of Central Connecticut, with 3 positives and 35 PUIs. And Wyndham Hospital with a single positive and 5 PUIs. So in the acute care settings right now, we have, as I said, 37 positive patients. So patients positive confirmed by the PCR testing. We have 37 in the system and 240 patients that we're currently working up medically evaluating for the COVID disease process. On the outpatient side and behavioral health network, there's no positive or no PUIs right now. And for the community health network, we have 83 patients that have transitioned and are now in their homes getting care from that extension of the Hartford Healthcare care team. And so 83 positives in the community health network and 11 PUIs. So total throughout the system, there's 120 positives and 251 PUIs throughout the entire Hartford Healthcare system. And that's our update on our numbers. A few things as we begin our morning. The state of Connecticut is reopening tomorrow into the second phase. So the second phase of reopening is happening tomorrow. And that will include certain areas such as parks, I think indoor dining for restaurants. There's also like service areas such as salons will be opening as well. And while we do that, every time I come up here, I continually will say, when this was at its peak, we ask that we maintain social distancing, and we ask that we recognize symptoms early, we isolate ourselves if necessary. There's significant capacity and capability for testing now throughout our state, and that's something we should, put every effort to be a part of. I think right now we've tested it with 354,000 individuals, which is quite a significant feat. 354,000 we've tested, quite a significant feat, and we'll talk about that just a little bit more. But as I said, as we reopen, social distancing, although we're in the second phase of social distancing, definitely ensure we're wearing the appropriate PPE when we should be, and recognizing symptoms very early. And keep in mind, we're still very cautious with our very vulnerable population. And as long as we maintain that, we should continue to work and move in the right direction. So I'm very excited about that piece. Another indication that there's progress and there's change epidemiologically is we are removing the tent at Hartford Hospital. The process started happening yesterday. The tent was set up in order to facilitate surge capacity, our expectation and our preparation was to, if we went beyond our capabilities within the walls of the hospitals, we would be able to facilitate that. But the system that's set up still maintains is to ensure that we do still have that capability and the ability to respond with increasing capacity in getting those systems online as soon as possible, much quicker than we did before, to facilitate any surges, not just with COVID, but with anything else that does happen. We still have the forward triage tent. It, as I said, is a place to keep COVID suspected patients separated from the ED patients. And that's a part of our commitment to ensure that we're maximizing the safety effort to ensure that patients that come in feel safe. And we're, as much as possible, separating those patients that we believe are highly suspicious of being COVID positive or being exposed to the disease process in this area before their transition, if needed, to the acute care setting with the appropriate PPE and the appropriate levels of precaution. So again, the triage tent is still up and running. It's a part of the emergency department, and it's a part of the safety measure to ensure that all processes are put in place to triage and separate the people or the individuals or patients who we believe might be exposed or positive COVID. Testing, as I said, we've been, over a few weeks ago, I think when we started this process, we discussed how do we maximize testing, and at that point, we started at, I think, 150 tests available daily throughout the Hartford healthcare system, and right now we're trying to provide over 2,500 tests per day. So that's quite incredible and a huge feat, Steve will talk more about it in a minute. I'll introduce Steve. But as a state, we've gone over 350,000 tests. That's absolutely incredible. And one more step that we will be taking with that is opening up another testing site this afternoon. Actually, it's in Bloomfield. It's a First Cathedral Church. So this will be at the First Cathedral Church in Bloomfield, so Bloomfield, Connecticut. And it's a church that serves the community very well, so we're collaborating with them to ensure that there's access to not just the Bloomfield community, but for the surrounding communities as well. I will be there. Tina, again, thanks, Tina. So Tina is telling me I'm supposed to say, so I will be there as well. Myself and Steve, who I'll introduce in a minute, will be there. But the most important piece of this, we've expanded our capacity for testing, and now we want to expand, or we've been trying to really hard expand access and expand our capability to everyone within the state as much as possible. So again, today, Bloomfield, collaboration with the First Cathedral Church, will be opening a test site for the COVID-19 disease viral test. At this time, I'm going to introduce Steve Donahue, who's a respiratory therapist of Hartford Hospital. He's been pivotal in setting up and organizing and orchestrating the whole testing process. There's so much data and so much predictive modeling and analysis that we've used. What Steve and his team has gotten for us from testing data. So there's much we couldn't have done without Steve, and I genuinely appreciate his effort. So Steve.
Good morning, everybody. First, I want to say kudos to the citizens of Connecticut, the mayor, our governor, our hospital administration. We've done such a great job managing this unprecedented pandemic that it's kudos to everybody. With that being said, we should not relax ourselves. We should still continue to social distance, and we should practice all the behaviors we've been doing to really stay ahead of this. So again, kudos to all. Today, what I want to talk about is the testing and the testing process. As Keith mentioned, that's a lot of people that's been tested, and of that population of 300,000+, 30% of that population has been tested through Hartford Healthcare. So again, so proud to be part of the organization to be able to stay at the forefront of this very challenging pandemic. Well, you would think with the second phase of the state opening that testing would actually be decreasing, but what we're actually seeing is more of a rise on the testing right now. And why we're seeing that rise is we're trying to do more of all of our pre-op patients will be tested. We recognize here at Hartford Healthcare that many of our communities don't have the capabilities to come to our drive-through sites. So we are revisiting locations within the Hartford community, the greater Hartford community, to take our testing capabilities to locations. As Keith just mentioned, today we'll be at the First Cathedral Church in Bloomfield. This is our 9th community event. We've been throughout Connecticut. We've been to prisons, halfway houses, senior citizen communities, assisted living communities, prisons. We've been everywhere to stay in front of this disease, and again, we are doing a good job with that, and I want to make sure that we continue to practice good behaviors to stay ahead of this curve. You know, the process now has come a long way. When we first started doing this in March, you know, it was limited supplies, it was limited test kits, getting orders and meeting your criteria. All those challenges have been eliminated now. It's so easy now to come and be tested. The process really, some of our drive-through has wait times online, so you can see how long it will take. But the process coming through in the drive-through is about a little under 2 to 2.5 minutes to actually come through the drive-through site and get tested. It's a non-invasive procedure now. We call it an interior nasal swab, which is the tip of your nose in a circle for 15 seconds. So it's not as invasive as it was before. It's less scary. But just again wanted to really emphasize what Keith said. We still need to keep our guard up on this COVID. We still need to practice all the social distancing, but we've come a long way with the testing and our testing capabilities. So with that being said, I want to thank you for your time this morning, and I will be available to answer questions.
Good, awesome, thanks.
Hi, it's Bridget at the Republican American. I'm not sure this is the right time to ask this, but can someone comment about the interest in dexamethasone as a remedy for COVID? It is a pretty powerful anti-inflammatory, but can you tell me more about that?
Bridget, so I'm not too sure. Can you repeat your question? Which specific drugs? Can you just repeat the drug question again?
Dexamethasone, it's a steroid.
Okay.
There is some interest now in dexamethasone as a remedy for COVID.
So, and within the treatment protocol, and I think, you know, after this question, I'll introduce another member of her team to discuss something else. But in the treatment protocol, and you know, steroid has been involved in the beginning, and even now there's still some algorithmic treatment protocols that include steroids. So as part of those algorithms, specific steroids, which include the one that you've spoken of, have been included as well. There's, you know, I don't say if you do your research, but there's a lot of controversy with some of the treatment protocols that has been used and some of the medications that have been used, and steroid is one of those. In the fact that steroid being used with an infection itself, within itself is somewhat, from an IDSA guideline, there's some debate on that. So I think that's all the information I have on it specifically. But with that being said, you know, one of the things we spoke about is how safe the hospital system is, and how safe it is to come into the hospital and get health care still, and how much we've spent in effort and time to ensure that the safety is extended. The other thing we've spoken about, we've had many people on speaking about how much patients that have gone through our services over the last few weeks since we've reopened to elective care, how much they've expressed of feeling safe, and how, you know, we are tracking people and ensuring that recovery is going well with very, very high degree of success. So one people I want to introduce to you is Dr. Ali, who's a System Director of Advanced Wound and Hyperbaric Medicine at Hartford Healthcare. Dr. Ali will talk about like his services and how intricate it is for this specific population, like all other populations, to now reach out and ensure that they're getting the highest level of care without fear of getting infected by COVID viruses. So, Dr. Ali.
Good morning.
Good morning, Dr. Ali.
Am I visible or?
You're all, yep, you're visible.
Okay, very good. All right, thank you all and good morning to all. I'd like to begin with a quick definition of wound care. It sounds like a fairly simple thing, but actually it's quite a specific subspecialty. This is far from the usual cuts and scrapes and bruises that many of us encounter in day-to-day life. The type of wound care that we'll be talking about briefly involves wounds that are caused by other significant ailments, such as diabetes, disorders of your circulation, pressure sores, or wounds that are induced by smoking and poor nutrition. These wounds are especially stubborn and usually do not respond to healing spontaneously. They therefore require specialized treatments, and that's where our wound care centers throughout the system come into play. I would like to state that it's quite important for us to keep seeing these patients even throughout the COVID pandemic, primarily because the wound itself in this particular population poses significant risks that we wouldn't usually think of. Some of these risks involve more than just non-healing. For example, these wounds can lead to significant infection, and sometimes the flesh-eating bacteria that we hear about, unfortunately so much, these wounds are almost a sitting duck for that type of infection. Patients can experience increased pain, sometimes requiring narcotics, which we would like to avoid nowadays. Bleeding is a problem. Erosion into deeper structures, such as the muscle and the bone. This can lead to significant disability and sadly, sometimes even an amputation. So as we can see, these types of wounds are quite dangerous if left untreated. And enter COVID-19, which left us with a significant dilemma. We knew that a lot of our wounds needed to be seen for the reasons I just mentioned. Mm-hmm. However, with this new contagious, aggressive virus, was it safe to keep seeing these patients? So truth be told, when this first began a few months ago, as we were discovering the unknown, we drastically decreased the amount of patients we were seeing for safety's sake. However, as Hartford Healthcare and its experts, guided by CDC guidelines, learned more about infection prevention, we implemented certain measures at the wound centers to ensure safety and have started to reach out to our established patients, and I'd also like to reach out to potential new patients and encourage them to come to our centers because we believe we are safe. A lot of the protocols that we follow, Hartford Healthcare protocols, have been thoroughly examined and vetted and updated, in addition to stringent staff and patient screening measures and waiting room and examination room protocols. We believe that the safety of the visit outweighs any kind of risk posed by catching the virus. So again, in this very specific, fragile wound care population, as long as we follow our protocols, I think it is perfectly safe for these patients to be seen at our centers. And I would like to encourage our patients to reach out to us, even if they have a question. You can just call us directly. Most of the time we could decide whether or not you need to be seen, or at least schedule a telehealth visit. And with the help of your cell phone and our cameras, we can actually see the wound and decide whether or not you should come for a visit.
Good, good. So, and Dr. Ali, I know one of the comorbidities identified for the COVID-19 diagnosis that increases the mortality is diabetes, and it's very similar to one of the comorbidities identified in your world as an increase in non-healing wounds.
Yes, absolutely. So the worse the wounds are, the deeper they are, the more hospitalizations and ultimately amputations that directly affects the course that diabetes takes. And sadly, advanced wounds, and especially those that lead to hospitalizations, infections, and amputations, really have, fatality rate that is quite scary to be honest.
Okay.
The goal of our wound care is to salvage these wound patients and their limbs and to promote healing so that we never open that door and go down that pathway. So in essence, if you heal their wound, you can save their life.
Good, perfect. And then, and is it fair to say that one of the number one ways or one of the best tool we have is early diagnosis and early treatment for these wounds?
Absolutely. Similar to many other diseases, if we can jump on these wounds relatively early in their course and apply our specialized treatment protocols, the vast majority of times these wounds will heal without much fuss.
Good, perfect. So the quicker you get in to get treated into what is now a safe place to visit and see Dr. Ali and his team, the better your prognosis is. And that's according to Dr. Ali and again, Dr. Ali, System Medical Director for Advanced Wound and Hyperbaric Medicine at Hartford Healthcare. Any questions for myself, Steve, or Dr. Ali at this time?
Hi, I'm Daniela Gonçalves. I'm with WTIC News. I just wanted to ask about the phase 2 reopening tomorrow, when essentially this second phase is going to have many more businesses than the first phase in reopening, and arguably more people will be going out. So I'm wondering, what are the concerns of any rise in cases or anything like that, or if there even is a concern, considering with the first phase of reopening we still saw a downward trend in hospitalizations and that kind of thing?
Yeah, that's a very, very good question. So I would say the concern is as it's been. Again, one of the questions that I've been getting a lot, and hopefully this will help to answer that question. One of the questions I've been getting a lot is like, Keith, I feel like now it's a good time for me to have people over and have a barbecue as long as I practice social distancing. So the minute we move out of social distancing and social isolation and separating your family from another family, the minute you're increasing your actual risk itself. However, if we keep in mind that the barriers, if we put the barriers that are in place, as we get our families closer, maintain a certain degree of barriers, we could do this with some form of safety. And I think if we practice this reopening, if we practice within this reopening, with expressing those barriers, then we should be coming out of this very, very safely. We shouldn't see an increase in numbers beyond, a huge increase in numbers or any big increase in numbers. I can assume that the risk itself or the opportunity itself is going to decrease exponentially, because now you're going to have people that are in buildings. You're going to have people that probably won't always be aware of that 6 feet distance between themselves and each other. And hence the reason why institutions have been communicated to ensure that these measures are in place. Restaurants structurally need to set up in order to facilitate that level of and degree of separation. We're encouraging individuals to encourage patrons that are coming into their businesses to be wearing a mask. We're encouraging employers to encourage their employees that if they do feel symptomatic or have any level of symptoms, they should get tested as soon as possible. And as always, within the COVID pandemic, before the COVID pandemic, and probably hundreds of years after we're all gone, I will encourage, and the statement will still be true, about using proper infection prevention practices such as hand hygiene, cover your cough, and maintaining a healthy lifestyle. And one of the things that we've seen with this disease process is expose the fragility, or I guess you could use that term, in people or patients who, haven't been able to, or haven't ensured that they're practicing as safe as possible, and ensuring that their bodies are as healthy as possible, and hence it's increased the comorbid risks.
Thank you.
That was very long. Any other questions? Tina, anything? No? All right, good. Thank you guys. Have a good day, and we'll talk soon. Say goodbye.